Denco microscope has really exceeded my expectation in terms of the ease of maneuverability and stability of the microscope, and also the optics. The lights are really great, and also in especially curved canals, the non-cutting edge is a good advantage for clinicians to prevent ledging and also stripping the canals.
Hello everyone, this is Chris from Denco. Now we have our Malaysia friends, which is specialized in the endodontics. Now I'm doing an interview about our Denco's microscope. So here is the question one. As an endodontics, how important you think about the microscope in your daily work?
In endodontics, we're only as good as our eyes can see and our hands can maneuver in the realm of microscopic dentistry. So if you are a clinician that looks for a good outcome in endodontics in the treatment that you do, I think a microscope is mandatory.
So the question two, what do you think about the Denco microscope in terms of the clarity and stability?
As a user of different brands of microscope myself in different clinics, I find Denco microscope has really exceeded my expectation in terms of the ease of maneuverability and stability of the microscope, and also the optics. The lights are really great, so it's a really good investment in my opinion. Yeah.
Okay. So for the question three, when shaping curved canals, what do you usually pay attention to? Facing the difficult canals treatment like that?
I believe in endodontics is like I compare it to playing a game. So there's no single strategy that helps you win every game. So in terms of curved canals, usually you want to pay attention to the degree of curvature and also how calcified is the canal. Using dual shaper has really improved my game in the topic of curved canals because of its safety. The flat side of this file is really a good indicator for me to recognize how stressed is the file in use. And also, in especially curved canals, the non-cutting edge is a good advantage for clinicians to prevent ledging and also stripping the canals.
So the last question is, would you like to share some experience about the microscopic endodontics treatment to any other students?
As I mentioned earlier, our eyes are only as good as our eyes can see and how our hands can maneuver in the tight space of endodontic canal. So in endodontics, we are essentially working in a space as small as the green bean. So magnification is really crucial for us to know, to find out the challenge that we are facing in every case. So if you can recognize the problem and the challenge in each treatment, you can tackle it better. So for instance, if you have a deep apical split, you can't really treat a deep apical split if you don't have a microscope. And if you have a ledge in the deeper part of the canals, you can't really recognize it without a microscope. So if you want to perform above the level of your colleagues, or you yourself has a better interest in endodontics, I think it's crucial in order for you to be able to treat the cases that others can't. Yes.
So thank you for your share. It's Dr. Martin. And